What's up, guys? It is yours truly, Dr. I, and my little big brother, Dr. J, and we are here for our monthly house call. Now, I know what you're thinking. I saw you guys 2 weeks ago, so how's this a monthly house call? It is a calendar month. It is a new month. So we're here for our monthly house call. You know how this works, guys.
Twin Doctors TV, blackdoctor.org, the monthly house call. I'm going to speed it up for him. This is dragging right now.
I'm just trying, you know how this works. Any questions you have, send them to us. We'll be happy to answer them. Right now, Dr. J said that we got a few questions on the internet, so we're going to start with those. And but feel free to just jump on in and get it going. All right, Dr. J.
All right, so the first question we got...
It says, hi, Dr. J.
Well, yes.
Dr. I.
So she sent us a question. I'm going to try and condense it a little bit. But so whatever, I'll read it. So she said, I lost my second daughter to spina bifida. I had a pregnancy that wasn't viable. After that, a lot of blood work was done, and it was found that I had what's called an MTHFR mutation. Lately, I've been hearing more and more about it. I have some depression and anxiety issues that I've read could be caused by the mutation. I'm also difficulty losing weight. Again, wondering if it's caused by the mutation. When she had a successful pregnancy, she was started on a high dose of folic acid, wondering if taking that might be helpful now. So basically, MTHFR, or methylene tetrahydrofolate reductase, mutations are mutations that affect how our body metabolizes folic acid or folate. Folate is a principal component of DNA, and so basically, if the body's not able to properly metabolize folic acid or folate, there can be some difficulty in synthesizing or making DNA. Very problematic for pregnancies, obviously, because once you've had an egg that's fertilized, it's got to divide and replicate, and it's got to make new DNA to do that. And so when we treat people who are pregnant and they have MTHFR mutations, we have them take a high-dose folic acid. Basically helps to overcome their inability to properly metabolize folic acid. Very helpful for both prolonging pregnancies in people with this condition and in preventing side effects that can result, like clotting disorders. In general, though, MTHFR, as far as we know, now maybe there's going to be more research to find something later, but as far as we know, MTHFR is really just a problem of pregnancy. It's a problem that can result in an increased risk of miscarriage early in pregnancy, can result in intrauterine fetal demise or pregnancy loss later in pregnancy, and can result in the formation of blood clots that can develop in the legs and travel to the lungs, and taking the high-dose folic acid helps to eliminate that.
So I think that one thing that Dr. J said that's really important to know about that. So first of all, an MTHFR mutation is actually pretty common. It is the most common of what we call the coagulopathies, which are conditions that can cause the blood to clot abnormally. So a lot of
about 1 in 11 people have it.
I was going to say like 10%. So a lot of folks are going to have it. The key, however, is not just your MTHFR status, but it's also homocysteine. Homocysteine is a structure that's in the blood that if you have certain MTHFR mutations, it can elevate your homocysteine levels. So if you do have an MTHFR mutation, you need to make sure that your doctor also checks your homocysteine level. If the homocysteine level is high, then you have a higher risk for clotting, and you need to consider a high-dose folic acid. And it kind of leads into that. Another segue is a lot of patients will come to us and they'll say, like, I've had 2, 3, 4 pregnancy losses, generally pretty early, sometimes a little later, like 12, 13, 14 weeks along. And what I tell, and a lot of times doctors just say, oh, it happens, miscarriages happen, not a huge deal. Do you have a question? Because, okay, so I was gonna say, I'll be quick with this. So if you are someone who's had 2 pregnancy losses or more consecutively, you're what they call a habitual aborter, which means that you need to do a workup, which includes MTHFR, homocysteine, something called factor V Leiden, antiphospholipid antibody syndrome, what they call a hypercoagulability workup. So just make sure that if you lost 2 or more pregnancies consecutively, talk to your doctor about that. Okay, Dr. Renee, we got a question.
What is the root of diverticulitis? What causes it? I'm scared to have surgery.
Okay, so diverticulitis. So diverticulitis starts with something called diverticulosis. So if you look at the intestine is like a tube, and so you get these little outpouchings in the intestine. It happens partially just with aging, but also if you have harder stools, if you have chronic constipation, that can also cause diverticulosis.
Also, just a poor diet in general. You know, one thing in this country in particular, we don't have enough fiber in our diet.
Yeah.
And so when we eat fiber, part of the benefit of eating fiber is that the muscles that surround the intestines have to really squeeze and contract to move that bulky, fiber-rich stool
So it makes them stronger.
Exactly, so it makes those muscles stronger. If you don't eat a lot of fiber, the muscles get lazy because they don't have to work to move stuff through. And so when those muscles get weak, they become very thin, and then you get like little holes in the muscles, basically, and so you get these little outpouchings, or these little pockets, or like these little hernias of the colon, basically. And that's diverticulosis.
Now, diverticulitis is when you get an inflammation and potentially an infection in these diverticula. Now, you may have just one episode of diverticulitis. They admit you, they put you on bowel rest, meaning they don't let you eat necessarily. They'll give you antibiotics, and frequently will resolve. However, if you're having multiple episodes of diverticulitis, especially if it's restricted to a certain part of the colon, then you may want to consider having a partial colectomy where they remove the part of the colon that is. But if you don't want to have surgery, there are some things you can do. So you want, and I'm sure your doctors maybe told you this, but you want to stay away from things that have seeds, because the seeds can become trapped in the diverticula and increase the risk of diverticulitis.
Seeds and nuts.
Seeds and nuts. You want to increase the fiber in your diet, and you want to make sure that your stools are softer. But if you've had multiple episodes of diverticulitis, it may be, because the problem is like with any infection, but especially infections in the bowel, they can spread body-wide. So it can be dangerous.
And it's not only that, diverticulitis, a little diverticula can rupture.
They can rupture as
and
well.
You can leak stool into the belly, and you
Exactly.
can get a life-threatening infection. Also, the chronic inflammation from diverticulitis can increase your risk of colon cancer as well. So, I mean, if you've done all of the things you said, like the fiber-rich diet, you've done the stool softeners, sometimes they'll do antibiotic courses, things like that, and the diverticulitis is persisting, then sometimes getting the hemicolectomy where they remove a portion of the colon is the best option.
Do you have any vitamin or supplement recommendations for people eating a vegan diet?
Well, so I mean, the thing about a vegan diet is, and I'm sure most people know, but just just to do a little recap here, vegans are vegetarians basically, but also in addition to being vegetarians, they tend to avoid dairy and things of that nature. And so the main thing about any type of vegetarian, be they just your run-of-the-mill vegetarian or a hardcore vegan, is protein deficiency. So typically vegans and vegetarians get quite a few of the vitamins they need, because when you eat fruits, when you eat vegetables, that's where you're going to get all of the vitamins that you need. The concern more with vegetarians or vegans is that they don't get a lot of protein, because meat is a source of protein for a lot of people. Also, they may not get enough iron, because meat tends to be a source of iron. Having said that, if you have concerns about a vitamin deficiency, then I normally tell people that you just want to make sure that you eat a multivitamin that is derived from fruits and vegetables. If you're a vegan or a vegetarian and you're eating fruits and vegetables, you're likely already getting those vitamins, and so the concern would more be with doing iron supplementation. If you're anemic, if you're not, don't worry about it, and making sure that you get enough protein. But one great source of protein, if you're not a meat eater, is going to be tofu.
Yeah, I was going to say, but also you want to look at the things that you could potentially be missing in your diet. So legumes have a lot of iron in them. So if you're vegetarian or vegan, make sure you're getting legumes. Make sure you're getting a lot of leafy green vegetables. Those have iron as well. So you're looking for sources of iron that you can eat. Like Dr. J said, because vegans don't eat dairy, there can also be calcium and vitamin D deficiency. So that's something to consider as well. And honestly, most folks, especially in places like Chicago where there's not a lot of sun, we're vitamin D deficient anyway. So most folks should be taking at least 5,000 units of vitamin D daily.
That's a good point.
At least. So make sure that you're getting your calcium, getting your vitamin D, like Dr. J said, a vitamin from a plant source. Make sure you're eating lots of legumes, as well as lots of leafy green vegetables. If you have a specific concern, talk to your doctor. They can do an actual panel to check your vitamin D levels, vitamin E. They can check all of your levels, and you can kind of target to that if you have any deficiencies.
What are the best iron supplements?
So the best iron supplement, so this is the thing, so there aren't necessarily a best iron supplement. I tend to recommend when you're supplementing with anything, get either a liquid or a chewable, because what you will notice a lot of times, be it a multivitamin or iron, if you take the pill that you just swallow, a lot of times it doesn't get absorbed well. So go for liquid, go for a chewable, and also have either a vitamin C tablet with the iron, or drink orange juice with it, because that increases the absorption of the iron itself. Okay, so that's all she's got. So, any other questions?
We do have a question. Let's see. So, this person was asking, how long does the HCG hormone remain in the body after pregnancy? For all intents and purposes, so just again to recap a little bit, HCG is the main pregnancy hormone. So it's the hormone that's produced by the placenta when you're pregnant, and it's the hormone that's responsible for a lot of the symptoms of pregnancy, nausea, vomiting, all of that stuff. The HCG levels normally rise exponentially during the first trimester of the pregnancy, and that's why people feel really bad during the first trimester. Then they kind of plateau, and a lot of times people feel better. They call the second trimester of pregnancy the honeymoon of pregnancy, because those levels have plateaued. You're not feeling the nausea and the vomiting and the headaches and the dizziness that comes from the HCG, and you don't have the physical discomfort that comes from the third trimester of pregnancy and carrying around that big belly. And then third trimester of pregnancy, they start to slowly increase again, and so you see some of those symptoms of the first trimester. Once you deliver that placenta, the HCG hormone typically will drop by about 50% every 24 hours. And so normally within 2 weeks or so, the HCG hormone is more or less out of the system. Now there are some caveats to that, but for all intents and purposes, within 2 weeks, the HCG hormone is going to be out of the system.
But it also depends on how high your HCG level was when the pregnancy ended. So, the HCG level peaks in between like 10 and 12 weeks. So at that point, you may be between 100,000, 110, 120,000. So it's going to take a long time. But if the HCG level is low, so if you have a miscarriage early in the pregnancy, if you have an ectopic pregnancy, or if it's at the end of pregnancy, then the HCG level is going to be low again. It shouldn't take more than a week or two. But if you're talking like 10 weeks pregnancy, it can be up to a month for it to come out of your system. So if you have a particular question, because there are certain reasons why people want to know if they've had a miscarriage, if they've had an ectopic pregnancy, things like that, the situation kind of varies. So, if you have a particular concern, definitely ask us. If not, go ahead, Dr. Renee.
Do you have tips for the cold and flu season?
So I have tips for the cold and flu season. Okay, so my first tip is, and I know I'm going to get a lot of flack for this, but get your flu shot. So as an OB/GYN, I'm in the office with people all day and I'm asking, do you want your flu shot? And some give you a long reason and say no, some just say no. And I think especially in the Black community, there's a lot of misconception. I always hear, I got the flu when I got my flu shot. I got sick when I got my flu shot. No, you didn't. You have what's called an immune reaction. That's what the shot does. Congratulations. It's going to make you feel a little bit crappy because your immune system's like, hey, this thing is in my body that doesn't belong. I'm going to make antibodies so when the real deal, i.e. the actual flu is introduced to your body, you won't get sick. So number one, get your flu shot. Number two, and this is something we should be doing all year long anyway, but wash your hands because the flu lives where? It lives in your nose. And so what's going to happen is usually people like blow their nose, they touch something, you touch your nose, there you go. Third thing to do, a neti pot. I use a neti pot every night. It is because of these horrible dark circles under my eyes. I'm trying to wash all those allergens out, but also that will get flu virus and cold viruses out of your nose, which is where they live. So wash your hands, use a neti pot every night, and for the love of God, get your flu shot.
Also, warm salt water gargle, don't forget that. The reason that the neti pot is beneficial is the same reason that the warm salt water gargle is beneficial. The viruses that cause cold and flu are what we call halophobes and thermophobes. They don't like salt, they don't like heat, and they tend to hang out in the nose and in the throat. And so if you do the warm salt water gargle, heat, salt, gets rid of the viruses that may be hibernating in the throat, and then the neti pot, or especially if you use saline water, does the same for the viruses that are hibernating in the nose. Also, vitamin C. Vitamin C helps to boost the immune system, very good for preventing cold and flu. Zinc. I was going to say zinc's another one. Zinc helps to boost the immune system, and again can help lessen the likelihood that you're going to get cold and flu. So if you do the zinc, vitamin C, warm salt water gargles, neti pot, wash your hands, get your flu shot. It decreases the likelihood that you're going to get the flu quite a bit. And the thing about the flu is, people think that the flu is just the flu. It's kind of like a really bad cold, but I'll get over it in a couple of days. The flu kills.
Because I would just say, the flu shot's not perfect. So I got my flu shot last year and then I got the flu. How many times did I go to the ER, Jamil?
2 or 3 times.
I went twice in the span of 3 days. I thought I was going to die at like 103 feet. No, seriously, I was like, I may die. Like, people actually do die with the flu. So like Dr. Jeff said, it's not like a bad cold. I mean, especially if you have asthma, if you have diabetes, if you have other chronic conditions, it really can kill you. So take it seriously, get those flu shots, zinc, vitamin C, wash your hands, do the neti pot. I'm sorry to cut you off, but I just had a flashback.
He got pretty sick.
Yeah, I did.
What is the best time to take BP meds?
BP meds. Whatever you're told.
So the best time to take blood pressure meds. There really isn't a best time per se. You just want to make sure that you're taking it roughly at the same time every day.
But can I walk that back a bit? Sure. I'm getting personal here, right? You can see Dr. He takes care of himself. She's sickly. So, no, I'm really not sickly, but I'm Black, and we do have certain conditions. So I diet, exercise. I do have high blood pressure, and it got pretty high. It's been high for a while, I think, and I kind of wasn't really accepting it. But anyway, long story. We can have the Freudian couch later. So I've taken multiple blood pressure medications, kind of playing around with them to see the side effects and so on and so forth. And right now I'm on a medication called amlodipine. But what you will find is that a lot of the antihypertensives, they work by dilating the blood vessels, which is what brings your blood pressure down. But one of the side effects of that is that you are tired.
That's just initially when you start.
Well, yes and no. It kind of depends. So what I tell people is, assuming, especially if you're taking it once a day, unless your doctor tells you otherwise, take it before bed. That way it'll help you sleep and you won't have that groggy sensation that you would if you took it in the morning. So that is one tip that I would give people.
I mean, there's no harm in taking it before bed. The reality is that you just want to take it roughly at the same time each day so that it maintains a therapeutic level in your blood. He is right. When you first start blood pressure medications, fatigue, headaches, dizziness, those are all normal side effects that you can see. But typically within a week or so, they resolve, and it won't necessarily matter when you take it. But there's no harm in taking it before bed. Main thing is just take it.
Right, because again, I'm just being personal. But I'll be really quick to get another question. So I was on call this weekend, and I got hammered. Didn't get to go home for like 72 hours. And I got there the first time I realized, oh man, one of my blood pressure pills left, and I take like 3 a day because of the way it's dosed. And so literally by like Saturday, like I had a headache, I was dizzy. My blood pressure was like 150 or like 90 something. So my wife had to bring me my blood pressure medicine. So the point is not only to take it, but take it on time and take it every day. All right, go ahead, Dr. Renee.
Can someone with polycystic ovaries and fibroids be pregnant, and are there any treatments for it?
Yeah, so I mean, both polycystic ovarian disease or syndrome and fibroids are very common, especially the fibroids in African Americans. And both polycystic ovarian syndrome or PCOS and fibroids can make it more difficult to get pregnant, but with both of them, you can get pregnant. Kind of the barriers to pregnancy are a little bit different for each one. So with PCOS, people don't ovulate normally, and ovulation is the act of one of the ovaries literally releasing an egg. When that egg is released, it interacts with the sperm fertilizes the egg, pregnancy occurs. If you're not ovulating or not ovulating regularly, you're not releasing eggs as often, and that makes it difficult to become pregnant. A couple of lifestyle modifications can help with PCOS though. Weight loss, and there's been research that's shown that losing as little as 5 pounds, even if you're not overweight, can help normalize your ovulation a little bit. Second thing is decreasing the intake of fatty foods and sugary foods, because when your cholesterol levels are a little bit high, your blood fat levels are a little bit high, your blood sugar is a little bit high, you tend not to ovulate as much. And then exercising regularly, again, because it decreases your blood sugar, can help with ovulation. If none of those things help, then there are medications. One common one we use is clomiphene citrate or Clomid, and that basically forces those ovaries to release an egg every month. You ovulate, then your chances of becoming pregnant are quite a bit higher.
And can I connect this to the other question? So the other question was about fibroids. And like Dr. J said, fibroids are very common. They're benign tumors in the muscle layer of the uterus. And depending on their size and location, they can either interfere with fertilization, like if they're blocking the fallopian tubes, which is where the sperm need to get to fertilize the egg, or they can interfere with implantation. If they're in the cavity of the uterus, the fertilized egg just can't implant. Or if they're really large and the fertilized egg does implant, the uterus just can't grow properly to maintain the pregnancy. But while they are completely different things, PCOS and fibroids are somewhat related in the sense that most folks with PCOS tend to be overweight. And when you're overweight, you produce a type of estrogen called estrone in the fatty tissue. And fibroids are estrogen and hormonally responsive. So people that have PCOS aren't necessarily more prone to get fibroids, but if you do have fibroids and PCOS, they may be larger and they may be more symptomatic. The treatment for fibroids can be medical, so it can be hormonal medications like the birth control pill, pad shot, things like that, Lupron. There can be surgical
You
treatments.
said that so fast.
Well,
Hormonal medications like birth control pills, the Depo shot, there's a medication called Lupron.
I was going to go into that a little bit more, but I know people also want to know like about surgery, because a lot of times if you're having problems becoming pregnant and you have fibroids, it may be that you need to have what's called a myomectomy to remove the fibroid. The question that people invariably ask, I'll answer it as well, is there anything natural that you can do to reduce the size of fibroids? The main thing is, of course, diet and exercise. By lowering your BMI, by lowering your weight, you reduce your estrogen levels and you reduce the stimulation to those fibroids. You want to stay away from other forms of estrogen, so like eat organic meats, because meats that are treated with hormones can make the fibroids worse. Things that are naturally estrogen-like, so soy products, you want to stay away from those as well. So the question about fibroids and PCOS, you actually can get pregnant. It may require a little work depending on how bad the PCOS is and the fibroids are, but the keys would be weight loss, making sure that you're ovulating regularly, and if the fibroids are really large, maybe having them removed to facilitate easier pregnancy.
How do you diagnose PCOS?
PCOS basically is diagnosed using a blood test and then ultrasound. So PCOS, polycystic ovarian syndrome, is a true syndrome, and a syndrome is just a collection of symptoms. And so when you have a syndrome, you may have literally every symptom that can come along with that syndrome, or you may just have a couple of them. You just have to have a collection of the syndrome, or of the symptoms commonly found in the syndrome, to be diagnosed with the syndrome. And so with PCOS, the two things you really need to see are, one, we'll check a whole hormone panel, but there are two hormones in particular, one called FSH, one called LH. And if the amount of LH compared to the amount of FSH is 2 to 1 or greater, that's consistent with PCOS. So normally, no matter where you are in your cycle, your LH and your FSH levels are roughly the same. So if it's 6 today for your LH, your FSH should be maybe 5.7, 5.8, something like that. But when people have PCOS, if they're LH is 6, their FSH may be like 1 or 2. So anytime you have twice as much LH to FSH consistent with PCOS. Second thing they'll look for is
testosterone.
Yeah, I was going to say whether or not your testosterone levels are elevated. Because when you ovulate, so when your ovaries release the egg, they also produce this hormone called progesterone, which is kind of like the second female hormone along with estrogen. Progesterone is made from testosterone. So the ovaries, just like the testicles make testosterone, the ovaries do too. But the ovaries then use that testosterone to make progesterone when you ovulate. If you don't ovulate, you're not making progesterone, so your testosterone levels start to build up. So they'll see that LH to FSH ratio is 2 to 1 or greater. They'll see that your testosterone levels are elevated. And oftentimes, yeah, and your progesterone levels are low because you're not ovulating, and that's what you make using the testosterone after you ovulate. And then oftentimes they'll do an ultrasound to see if your ovaries have what they call this polycystic appearance. So you'll see the images of the ovaries and you see all of these little follicles or little cysts. You don't have to see that though to diagnose PCOS, but normally that's kind of the triad you see. The ovaries have that polycystic appearance on ultrasound, the LH to FSH ratio is 2 to 1 or greater, testosterone levels are elevated.
I just got diagnosed with Graves' disease. What can I expect?
So Graves' disease is a disease of the thyroid, and Graves' disease is one of those funny ones in the sense that when we're looking at the thyroid, taking a step back, the thyroid is a gland in our neck that kind of regulates the metabolism body-wide. So if you have issues with the thyroid, you will have symptoms literally from head to toe. Sometimes your thyroid can be overactive, so you have weight loss, you're jittery, you have high blood pressure, you can have diarrhea, things like that. Or you can have hypothyroidism, which is where the thyroid is underactive. So you have weight gain, you may have constipation, you kind of feel slow, you can have depression, things of that nature. With Graves' disease, what happens is you make these antibodies to the thyroid, so they stimulate the thyroid. So initially, people with Graves' disease will be hyperthyroids. They will have the symptoms of an overactive thyroid, weight loss, they feel jittery, they may have anxiety, their blood pressure's high. But then what happens is eventually those antibodies kind of knock out the thyroid and you go the other way. So you get hypo or underactive thyroid, so then you have the weight gain and you feel depressed and you have constipation and you just feel slow. So if your Graves' disease is not managed properly, you may go from the ups of hyperthyroidism to the lows of hypothyroidism. But if it's managed appropriately, and again, it depends on where you are. So if your thyroid is overactive, they can give you medications like propylthiouracil, methimazole, or if your thyroid is underactive, they can give you Synthroid, Armour, things like that. But if it's managed appropriately, and the way to manage it is to take the medicine and check your labs, if you're where you should be, you won't really notice much of anything. But if it's not managed appropriately, you go from hyperthyroidism to hypothyroidism, you'll be miserable either way. So you really want to manage it.
A friend was told he's borderline diabetic and was given metformin. I encouraged him to ask for a kit to test his sugar. Wasn't the doctor supposed to prescribe that also?
I mean, so when you hear that someone's borderline diabetic, I'm always curious what that means just because it's not like an official diagnosis, but a lot of times when we tell people that they're borderline, we mean that we check their hemoglobin A1C, which is this blood test that tells us what your average blood sugar has been for the last 90 days. And their hemoglobin A1C wasn't high enough that they were diabetic, but it was higher than the doctor would like to see it. And so that's likely what they meant when they said that he was borderline. A lot of times if someone's borderline, to be honest with you, you don't necessarily start medications, at least not first step. Normally you tell them to make lifestyle modifications, so weight loss, exercise, decreased intake of sugary foods, carbs, things of that nature. And not only would you not typically start medications if the person was truly borderline, you normally, honestly, wouldn't have them checking their blood sugars either.
But can I not to interrupt you, but I'm going to jump. Sorry. This is the one thing, though. It could be the A1C, but a lot of times they'll say you're borderline diabetic if you're what they call insulin resistant. So they'll check your insulin level. Insulin is the hormone that your pancreas produces to drive sugar into your cells.
Yeah.
If your insulin level is also elevated, but you don't meet the criteria for diabetic, they call you pre-diabetic. And in that case, they may put you on a medication like metformin, glyburide, to bring your insulin levels down. But either way, if they're pre-diabetic, medication may be warranted if their insulin levels are high, but they don't necessarily need to monitor their blood sugars at home, but they do need to diet, exercise, weight loss, and then follow up with their doctor. Oh, sorry about that. It's live. You need to follow up with their doctor at least in 3 months to kind of see where they are.
Yeah, check that hemoglobin A1C. Yeah, check the hemoglobin A1C level again, see if it's dropping. But no, I guess long answer to a short question, you don't have to necessarily check the blood sugars on a regular basis if you're borderline. Once you're diabetic, yes, you should be checking them on a regular basis at home.
My blood pressure was high 2 weeks ago. I stopped eating salt. Now today it's normal. Is it that easy? I was also on Keflex and Aleve for bladder infection.
Go ahead. I was just going to say, is there a link, first of all, between salt consumption and high blood pressure?
I want to say no. I want to
No. For years, we were told that eating too much salt would cause high blood pressure. And they would say if you're hypertensive, decrease your salt intake to somewhere between 200 to 300 milligrams per day. Recent research has found that the link between salt consumption...
More salt on my skin than that I might have.
Recent research has shown that the link between salt consumption and hypertension is tenuous at best. And in African Americans, it's really tenuous. So, so basically what they've said now is 50% of the time, if you're African American and you're hypertensive, decreasing your salt intake will improve your blood pressure. 50% of the time, you could eat no salt and your blood pressure is still going to be high. So the short answer is, can decreasing salt intake lower blood pressure in people in general and African Americans in particular? 50% of the time, yes. 50% of the time, no. I would be encouraged if I saw that my blood pressure had decreased with a decrease in salt intake, especially if I hadn't made any other lifestyle modifications. But at the same time, I would still monitor my blood pressures very closely. And your threshold for starting medication should be fairly low, to be honest with you. It used to be that we would say you start blood pressure medications when that systolic number, that top number, is persistently over 140, even 160 sometimes, or that bottom number, that diastolic number, is persistently over 80 to 90. We've really lowered the threshold now. They're saying if your top number is persistently over 130, yeah, that you really should be starting medications. And so improvement with decreased salt intake is a good sign. Continue to monitor the blood pressure though, and have a low threshold for starting the medication back.
Is to continue to monitor the blood pressure, because you can check your blood pressure on your right arm, then your left arm, 5 minutes apart, and they can be vastly different. So make sure that you're monitoring the blood pressure regularly and monitor it appropriately. So the way to do that is, before you check your blood pressure, empty your bladder, you want to sit down, you want to have your arm at heart level, feet flat on the floor, and then you kind of wait for a minute or two to check your blood pressure. But even if it's good once, that's excellent. But hypertension is episodic, so it'll be high, it'll be low, it'll be high, it'll be low. Then you want to treat the highs, not the lows. So make sure you're checking it a few times a day, every day. And if it truly is, lower, that's great, but it may not be.
What are your thoughts on bariatric surgery to reduce the weight, thus producing symptoms of PCOS?
So that's
bariatric surgery.
Bariatric surgery.
Improving the symptoms of
that is actually a great question. So this is the thing. So PCOS is kind of like a chicken or the egg. It's that stone that goes downhill. So we don't know if people have PCOS in part because they're obese, or if obesity in part can lead to PCOS. What we do know, however, is that treating the obesity, regardless of how you treat it, will definitely help with the symptoms of PCOS. And so we've seen many a patient who gets bariatric surgery because they always tell folks after bariatric surgery, don't get pregnant for X number of months, be it a year, be it
normally a year.
And 6-7 months later, they're pregnant. So
and the reason for that is because they haven't been having periods for so long. Right. They don't use protection. They figure, I can get pregnant, and then 6-7 months they lose that weight. They start ovulating, and boom.
There you go. So it will definitely help with the symptoms of PCOS, and that is huge because, like Dr. J said, PCOS is a syndrome. It's not just lack of ovulation, not just problems getting pregnant, but also bariatric surgery will help with a myriad of other conditions. It will reduce the risk of diabetes. It will reduce the risk of osteoarthritis because of wear and tear on your joints. It will reduce your blood pressure. It will reduce cholesterol, and it helps with PCOS and getting pregnant. So I am a fan of getting bariatric surgery if you have tried diet, exercise, weight loss, and it's just not working, especially if you have secondary or comorbid conditions.
Yeah,
it's not a magic. It's not.
Not to rain on the parade, because bariatric surgery certainly has a myriad of benefits, like he said, and especially they say if your BMI is over 40, that's when you really want to consider it. If it's less than 40. Maybe lifestyle modifications first. If it's over 40, especially if you've made lifestyle modifications, you're struggling, bariatric surgery can be helpful. But interestingly enough, research has shown that bariatric surgery works a lot better in men than it does in women. And oftentimes in women, for whatever reason, maybe it's hormonal, they see weight loss initially, but then over time, they start to pick up the weight again. Whereas in men, you don't see that as often. And part of the reason for that is, and part of the reason it fails in anybody, male or female, is that bariatric surgery addresses the physical component of obesity, which is, the stomach's too large, it takes a lot of food to fill it. By making the stomach smaller, it fills faster, you don't feel hungry, you don't want to eat from a physical perspective. But then from an emotional perspective, there's a psychological component to eating as well. I mean, how many of us eat because we're stressed, because we're bored, because we're tired, because we're this, because we're that? That has nothing to do with us feeling hungry. And so bariatric surgery, unfortunately, doesn't address the psychological component of obesity. And so that's why you tend to see people who backslide a little bit. They figure their stomach is smaller, they're not going to overeat, but they're not necessarily thinking about the psychological component of it. So it's not a magic pill, but it can be beneficial.
But it's a tool in the
yeah, exactly.
This one is urgent. I'm having low blood counts, hemoglobin 7.3. This week I'm having nosebleed. Should I go to the ER?
Yeah, so this is the thing. So hemoglobin, so hemoglobin, these are your red blood cells. average, you're looking at about, not average, but lower level of normal is about 12.5 or up. So you want to be at about a 12.5 or up because your blood cells are important. Literally, they feed your body from top to bottom, and they bring oxygen, which is crucial for your brain, for your heart. So you don't want to be anemic. Now, the body can it can kind of adjust if you're chronically anemic, but it's still not functioning optimally. So if your hemoglobin is 7.5, number one, yes, it should be treated. 7.5 is kind of in that borderline where they may or may not give you blood. It kind of depends on if you've got other conditions like heart disease, high blood pressure, and how symptomatic you are. But it does need to be treated. It could be acutely with blood, it could be chronically with oral or with IV iron, but it does need to be treated. It needs to be addressed, especially if you have a continued source of bleeding. If you're having nosebleeds, also when you have periods every month, if you have a continued source of bleeding, it needs to be addressed. The second question is, why are you so anemic?
It's either not being rude, by the way. It's literally the hospital text.
Oh, it's literally, it's either a question of I'm not making enough blood, in which case it could be more like an issue with your blood system in your bone marrow, or it could be more commonly that you are losing blood. Is it that you're having heavy periods? Do you have bleeding in your GI tract? Could be an issue with the colon. So treat the anemia acutely and chronically, but also figure out why you are anemic. That's the most important thing.
I am pregnant, my 3rd trimester, and this morning I drank a Vitamalta and drank Ferroglobin. Start drinking the Ferroglobin this morning because the folic acid and iron tabs that I got from my health center is causing me to vomit. I lie down to take a nap and got a throbbing pain from my neck straight down to my lower back. Could it be because I had the two so close together?
I don't necessarily think so. I mean, couple of things. When it comes to iron supplementation in pregnancy, I normally am not a big fan of it, to be honest with you. The reason is this. Not all, but most pregnant women will have what's called a physiologic anemia. So it means if you check their blood counts, they look low. But they're really not low. What ends up happening is when you're pregnant, your blood volume, so the water in your blood increases by about 50%. You put 50% more water in your blood, it dilutes everything. So if you check pregnant women's labs, everything looks low. Their blood counts look low, their white blood cell count looks low, their electrolytes look low, and it's just because the blood's diluted. So I tend not to encourage people to do iron to begin with when they're pregnant unless they're profoundly anemic. That being said, if you're profoundly anemic and you need to take iron, taking those two, even though you took them so closely together, wouldn't necessarily cause symptoms like that. The main concern with taking too much iron is you can get iron overload, like it'll get deposited in the liver and you get this thing called hemochromatosis. But that's something that occurs over a prolonged period of time. So you're taking too much iron day after day after day after day. If you just took those two back to back, no, I don't think it will cause.
But iron is caustic on the stomach, so it could cause it.
But she said from there.
I was going to cause some stomach discomfort, but if it's from the neck down, likely unrelated.
Now, one thing I would be concerned about, we don't want to, miss the forest for the trees here. If you're, especially in the 3rd trimester of your pregnancy, you want to make sure there's not something else.
That's what I was going to.
You can see something called preeclampsia, which is a condition where you get high blood pressures towards the end of the pregnancy, especially in African American women. More common if it's your 1st pregnancy or your 5th or more pregnancy. More common if you're younger than 21, older than 35. More common if you're African American, and that can present with neurological symptoms, and so you can have headaches, visual disturbances, pain in the upper right quadrant of the abdomen, things of that nature. And so those are things that.
So pregnancy is a time of musculoskeletal discomfort always, but if it's not something that goes away after 5 minutes, 10 minutes, definitely let your doctor know. But no, probably not related to the iron.
Okay, so she ate crabs 2 weeks ago and she has body aches, chills. No energy. Could this be food poisoning?
Unlikely, crabs. So this is the thing. So with food poisoning for the most part is something you will see within the first 12 hours or sooner. It can be up to or it can be as soon as 2, 3, 4 hours. So if it's been 2 weeks, unlikely. If you said aches, body pains, chills, so that sounds to me like it's probably more something that's viral. But yeah, if it was 2 weeks ago, I wouldn't be concerned about food poisoning at all. Plus, you tend to get more GI symptoms. You get discomfort in the stomach, nausea, vomiting, diarrhea, things like that. So probably not that. So rest, fluid hydrate, Tylenol for aches and pains and fevers, and if it persists for more than 72 hours, it gets worse. If fever's over 101, let your doctor know.
Recently diagnosed with PCOS and was treated for suspected PCOS. She was given birth control. Should she insist on an ultrasound due to her irregular cycle?
So this is the thing. I wouldn't necessarily. Okay, so with PCOS, you're gonna have an irregular cycle. That kind of goes together with the peanut butter and jelly. PCOS and irregular cycles are one and the same. So you're gonna have an irregular cycle. What you're gonna find is that if you're on birth control pills now, your cycle will regulate. And the one danger, there are other dangers, but the biggest danger I think of PCOS is the fact that because you're not ovulating every month, the lining of your uterus builds up that would normally be coming off every month, and so you are prone to get what they call hyperplasia in the uterus, which are abnormal but not cancer cells, or dysplasia, or neoplasia, which are actual cancerous cells in the uterus. So that's the big concern. So the only time I recommend getting an ultrasound for PCOS is in the initial diagnostic phase if they want to look at the ovaries for the cysts, or if you are not having a period at least every 3 to 4 months, you want to check the lining of the uterus. But just in general, if you've been diagnosed, they know that you have PCOS and you're taking medication, you're having relatively regular periods with the pills, you really don't need an ultrasound unless you have other things like pain or other issues that are occurring.
Okay, this will be the last one. Recently had abdominal surgery and experiencing necrosis. What do you recommend I do?
So I guess the question would be necrosis of what? So necrosis basically is just a term that means tissues dying. And so, anytime there's death of tissue anywhere in the body, it's a problem, obviously. Now, if you've had abdominal surgery and you're getting like necrosis of the skin, that could be the result of a wound infection. If a wound infection is not aggressively treated, the skin can start to die, and so you get necrosis of that skin. So it really would depend on necrosis of what, I suppose.
Okay.
Yeah.
All right, guys. Well, thank you. Oh, okay. She's on the book. So, this is our book. It is entitled "Everything You Ever Wanted to Know About Pregnancy, But Were Too Afraid or Embarrassed to Ask." The reason that we wrote it is because there are, as you might imagine by all the pages, a lot of conditions of pregnancy that people have questions about or that they're nervous about. They just don't want to talk to their friends about it. We'd love to have you all as our patient, but it's just not physically possible. What we can do is offer you this book to answer all the questions that you may have. So if you're pregnant, if your friend's pregnant, if your friend's friend is pregnant, if your hairdresser's pregnant, if your mom is pregnant, if anybody's pregnant in your life, get them this book. We promise you'll love it. And if you don't, well, you're crazy because it's a great book. It's a great book. All right, so
As always, this is our monthly house call. We'll be here next month. Please get your questions ready. blackdoctor.org. You're here, so clearly you know who they are. Fantastic organization. Dare I say, one of the most informative sites.
The most, not one.
There you go.
The most informative
site I've ever
site.
come across. Just like you like them, also don't forget to like us, Twin Doctors TV. We are Twin Doctors TV on Facebook, Instagram, Twitter, whatever social media you can think of. Our website, twindoctorstv.com. All kinds of interesting,
We need
informative
affirmation.
information. Exactly. Please like us, follow us, show us some love. Until next month when we're here for the monthly house call, stay well, guys.